Well, here's a related question. John, who calls himself Bay City Patriot, says, many states are challenging health care reform. If states protest health care reform by opting out of Medicaid, what will that impact will that have on the health care reform?
Well, I think it could have a very interesting impact. First, let me say, when states are talking about dropping out of Medicaid, the Texas governor is really the only one at this point who's been out there in front and said, we are seriously considering this. In other states, it's a discussion mostly at slightly lower levels. Some members of the legislature here or there are talking about this. Governor's offices, the staffs might be looking into what it would entail and what the possibilities are. But the effect, if it really did happen, could be huge. And I'll tell you why. There's a proposal out there right now coming out of the Heritage Foundation that talks about one possible option for doing this. And under this option, he says, 40 of the 50 states would actually come out financially ahead by dropping all that federal matching funding. What Heritage is saying is that people between 100 and 133% of poverty actually do qualify for federal subsidies, or at least many of them would. And let me take a step back here for a minute, because when we're talking about Medicaid, we're talking about a lot of people, they call them the acute care population, who are using Medicaid for their regular Medicaid, for their regular healthcare services. They're going to the doctor, they're going to the hospital, they're having a surgery. There are two other parts of Medicaid, two very expensive parts of Medicaid. One is long-term care. That's your folks who are both poor and require nursing home care or extensive home health care. And Medicaid also spends quite a bit of money on senior citizens. Now, seniors, you say, well, they get Medicare. Yes, they do get Medicare, but Medicaid helps them pay for their premiums, helps them pay for their co-payments, and this is significant. So this idea coming out of the Heritage Foundation says, okay, you take the states would continue would take full responsibility for their long-term care, their nursing home coverage, and also for helping the folks who are on Medicare, the senior citizens who still need help paying their premiums and with cost sharing. But the rest of the folks, they qualify for subsidies, they buy private insurance through the exchange, and therefore you're essentially giving them full responsibility to the federal government. Now, not everybody agrees that this is the case, and there seems to be some confusion about whether these folks really would qualify for subsidies. The people who wrote the law says that was not the intention. However, there are a number of folks in the government who are looking into this. They're kind of surprised by this, and we still don't have really an official word from the federal government that this would not be the case, that they would not qualify for subsidies. So this is kind of a big question and might be a deciding factor in whether states move ahead with dropping out of Medicaid. Now, you asked what would be the impact if they did drop out of Medicaid. If these folks did qualify for the subsidies and were turned over to the federal government, it would mean a lot more spending by the federal government.